fighting for fair contracts. KTVU's Amanda Quintana live at Stanford Hospital in Palo Alto with the latest on what's set to happen today. Amanda?
Yes, well, in just the last 10 to 15 minutes, we saw a lot of these nurses show up here and start to gather to form this picket line. It's nurses striking from both Stanford Healthcare and Lucille Packard Children's Hospital. They say their labor contracts for these 5,000 nurses expired on March 31st. Now, in a press release, members of the nurses union, Quintana, who are here, say they want Stanford and Packard to solve the burnout and exhaustion that's driving many nurses to reconsider their professions. They say hospital leadership refuses to acknowledge the reality of understaffing, requests for overtime, and the little time these nurses get to rest with their families.
The hospital is pretty tone deaf in terms of what is happening at the bedside and what is happening to nurses here. And we just want to show them that we're all here supporting each other and that we don't want to strike. That's not our goal. We just want to be able to get a fair contract that makes our job sustainable.
The hospital says they've worked to come to an agreement and feel they've made meaningful progress at the bargaining table so far, offering wage increases and retention incentive payments. In a statement from Stanford Healthcare representatives, they say, "We respect our nurses' legal right to take part in a work stoppage, but are deeply disappointed that the union chose this path. A union work stoppage is a serious event that's disruptive to our patients, families, and colleagues. The impact can be deep, long-lasting, and costly." The hospitals have taken away employer health benefits for these striking nurses, saying that they are only provided to employees actively working for the hospitals. An online petition trying to stop that decision has gathered almost 30,000 signatures so far. The hospitals will remain open during this strike. They are actually now being staffed by replacement nurses, and the hospitals say that because of this strike, they are having to push back some procedures. They are having to reschedule some things, but patients will still be able to get the care they need when they come to these hospitals. I know that more and more people are going to come gather here, so this is going to become bigger as the morning goes on. There's also a press conference happening at 9 o'clock this morning, so we will bring you all of that as more people start to gather here. Live in Palo Alto, Amanda Quintana, KTVU Fox 2 News.